Awesome. So thank you everyone for taking the time to be here today and join this exciting webinar session that is all about an introduction to hybrid effectiveness implementation approaches to study designs. And we have three fabulous presenters here today, Sara, Gabriela, and Ebrahim. And today's webinar is an extra special one because it's co-hosted and planned with from Kids Brain Health Network and Child Bright. So thank you everyone for being here today. This is the third webinar as part of our implementation community. All right, so before getting started, we want to take a moment to acknowledge and give gratitude to the lands in which we have the privilege to work, connect, grow, and do the good work that all of us, part of our respective networks and organizations and agencies do. So my primary affiliation and location is Canchild at McMaster University. This is in the city we now call Hamilton in the province of Ontario, which is the traditional territories of the Mississauga and Haudenosaunee nations, protected under the Dish with One Spoon Wampum Agreement, as well as Treaty 3 territory. We also acknowledge and recognize that as KBHN and Child Bright are national in scope and reach, we give gratitude to the many lands and acknowledge the traditional territories our networks work and operate on. So encourage everyone to take a moment to reflect where they're located and reflect on what that means to you from your perspective. So, given next week on September 30th is the National Day for Truth and Reconciliation, we wanted to highlight a couple of important resources. And these are ones that I've come across recently and have found particularly impactful. So, feel free to take a screenshot. I can also share them in a follow-up email after today's webinar. But I have found them to be very educational and supportive of my own learning and unlearning. And so with that being said, I also encourage everyone to, while the month of September, but also more broadly, to use this time to really focus on that truth aspect, that education, but then actions that you can take towards reconciliation every day. So Kids Brain Health Network's implementation community launched. We had our one year launch this month. And so it's very exciting to see how our community and its activities, events have really evolved and taken shape and form over the past year. And really, the implementation community has kind of four main goals. The first is to really build capacity and support Kids Brain Health Network, but also others working in the neurodevelopmental disability space in implementation science and the practice initiatives to discuss, ask questions, learn about complex, topical, and/or KBHN relevant implementation topics, topics we've heard from our community that have come up through different projects, learnings, doing implementation projects, etc. The broader neurodevelopmental disability community and network sharing, connecting, and co-learning. So meeting great people, such as our panelists and presenters here today, but also throughout our community and those who come to these different webinar sessions. And then overall to advance implementation science in the NDD field. And through this learning, this collaboration, this community, we really hope to achieve these goals. And our community includes webinar sessions like today. And again, the first time we're trying the webinar format. So please, hopefully everything goes smoothly. But likely there may be some hiccups along the way. And then we have our smaller community group chat. So this is more of a discussion and a reflection in our smaller KBHN specific implementation community that includes members who have currently funded through KBHN or past KBHN members, all working on a variety of implementation science initiatives. Cool. And if you would like to learn more about the Kids Brain Health Network implementation community, and again, we're officially 1 year old and have grown a lot over this past year, but would encourage you to take a look at our website. There's past webinar recordings there. There's more information about the different activities. And if you're interested in learning more, please do not hesitate to reach out. And I will pass it over to Corey.
What an amazing first birthday that we've had. I have to say, these series and sessions are so exciting. I'm Corey. I'm the Director of Implementation and Programs at KBHN, and I think many of you know KBHN. We're a national network really committed to advancing the spread, scale, implementation, and really expansion of proven solution for children with neurodevelopmental disabilities and their families across Canada. The network has been around for a lot of years, but we've kind of grown to be this family of KBH plus. We recognize that while we're funded by government to scale and spread implementation solutions and the network, there's a real role that philanthropy and the private sector can play in making sure that we have access and can improve outcomes for kids across all of Canada. So we work in partnership with everyone and really excited today to celebrate some of that partnership with Child Bright. So yeah, really excited about KBH Plus's new identity and would be thrilled to have conversations with anybody that wants to explore more about KBH. I'll pass it over to the next slide.
Great. So I'm Celia. I'm here representing the Child Bright Network, and we are very pleased to be co-hosting this session, really focused on implementation. So I am the co-lead for the training and capacity building group at Child Bright. Next slide. At. And many of you will hopefully be familiar with Child Bright as well, but we are also a national network, pan-Canadian, that's really focused on the patient-oriented research aspects, working really closely with youth and with children and with parents, all with connected to brain-based developmental disabilities. So we have been running for several years, really focused on developing some of that research and implementation focus with more than 500, I think, expanding rapidly around network members, really working very closely in many different positions with partners with lived experience, and have a active online presence. So feel free to check out the network. And the last slide is just around our mission, which is where we really work collaboratively with youth and parent partners, really aiming on focusing brighter futures for children and youth with developmental disabilities and their families. So excited to hear about everything today, and really glad to be co-hosting this session.
Amazing. Thank you so much, Corey and Celia. I also realized I don't know that I introduced myself at the beginning. My name is Vanessa, and I have the privilege of being the facilitator for KBHN's implementation community and working with people like Corey, Celia, Gail behind the scenes here to plan all of these fantastic sessions. So during the webinar, I don't know that you have an option to unmute. So again, we are playing around with these features as we use the Zoom webinar function. But we do have a Q&A feature, question and answer feature. So any questions that come up as you're listening to our amazing presenters today, please feel free to put those into the question and answer box or function. And then we will have an opportunity towards the end of the session today for our presenters to answer some of those key questions. And our objectives for today's session, again, through our three presenters, are first to gain a clear understanding of what hybrid effectiveness implementation studies are, to dive into three distinct types of hybrid studies, what sets them apart, how they work, and when to use each one to maximize impact, and then to learn from real-world examples, including a project from Child Bright, to see how hybrid effectiveness implementation approaches drive meaningful change. So very exciting stuff today. And then we would love to hear from you regarding your feedback on today's webinar. So I have a QR code here. I will also be emailing the feedback survey after today's session, and we would greatly appreciate your feedback and to help inform future topics and to figure out what works best in terms of bringing this community together for sessions such as these. All right, so I'll pass it over to you, Sarah, to introduce yourself.
All right, great. Let me first share my slides to make sure that I switched computers somewhat quickly, and so I don't completely trust my skills. So this is a fun game of can I use the computer? All right, share. I also have a habit of clicking leave instead of stop share. So if I leave dramatically, it's my skill level. It's not my attitude.
That's okay.
All right. Do you all see my slides now? Okay, fabulous. Cool. Okay. All right. So I'm gonna hop forward a couple because I have a little bit of introduction on my slides. And it looks like I didn't update the title. We're gonna ignore that. That's okay. I updated who you all are and the date, and that's kind of it. I'm gonna come forward a minute. We're gonna hop back and forth with slides. So I'm Sara Landes. I saw this picture from during the pandemic because we have this cool mural here in Little Rock, and I have yet to make my way back to get a non-pandemic picture. I am in Little Rock, Arkansas, which is, in case you have no idea where that is. So I'm in the US. Arkansas is that little red state. We are in the mid-South, and I'm in Little Rock. A little bit about the history of Arkansas. So I appreciate the land acknowledgement. So Arkansas and Little Rock sit on the lands of the Caddo, Osage, and Quapaw people. And we were actually, unfortunately, part of the Trail of Tears. So folks who were forced removal moved through Arkansas during that time in the early 1800s. So we have a tough history, and I think, are doing a better job of celebrating folks who are from here originally. But that's where I am physically. I'm actually in neither of those beautiful buildings on the screen. They've moved us again, and I haven't yet. Our building now is not that cute, so I didn't update the pictures, but that's where I'm physically at. I work at the Department of Veterans Affairs here in Little Rock. I direct our Behavioral Health Quality Enhancement Research Initiative, or QUERY. And then at UAMS, the University of Arkansas for Medical Sciences, I'm part of our Center for Implementation Research. I have this slide again later. I have 2 emails. Feel free to use either. Don't use both, because that makes me distressed that I think I haven't replied to. So feel free to contact me. I have a Twitter handle, and I don't go there very often anymore, but that's a little bit about me. Oh, and I'm gonna come back to my disclaimer, just so you know, I'm supported by a variety of funding. So our QUERY funding here at the VA, the South Central Mental Illness Research Education and Clinical Center, or MIREC, and our Translational Research Institute. And the views presented here are mine. I do not represent the Department of Veterans Affairs or the US government in many ways. And I want to give a shout out before I launch in. I'm going to mind the time because I want to make sure I don't get excited and ramble. So I have this written down, how much time I have and when I need to hush up. So before I launch in to talk to you about hybrids, I want to always give a special shout out to my mentor, Jeff Curran. So you may be familiar with his original 2012 paper about hybrid studies. He and I talk way too much and think too much about hybrids. We actually had journal club last night, and he said when he retires, I get to be the mayor of Hybridville, which I don't know if it's a good thing or bad thing. But we spend a ridiculous amount of time thinking about hybrids. So it's nice to talk to folks about what we've been thinking about. And I'll highlight to you towards the end, we offer consultation. So if you're thinking about doing a hybrid, you don't know what you're doing, you want some help, we do free consultation. You don't have to be part of our group. I don't have the email, but if you email me, I'll get to you the right person. We do monthly Center for Implementation Research virtual meetings, and folks from all over come and present either their idea or an Ames page. And we have a rather enthusiastic bunch of folks who will give you feedback. So just to highlight that for you, if you're like, ooh, I want more of this, we have resources for you. And Jeff's also just a lovely person. And we've written a lot of this stuff. And so I just want to highlight, not all these ideas are mine. So oh gosh, what did I just do? I've lost my slides and I've made you all really big. This is fun.
We still see your slides on our side.
Okay, now I can see them too. Okay, thank you. Let's see. I don't know if I can get you all back. All right, let me make it small for a minute. gosh, this is embarrassing. We're gonna not worry about it. Okay, so we're talking about hybrids. And you'll see, and Vanessa, I will send you the slides so you can link them somewhere for folks. Because I've tried to put in hyperlinks whenever I can to connect you to resources or to papers I talk about. And you'll notice it says hybrid designs scratched out and then studies. So the first paper that Jeff and colleagues wrote in 2012 was kind of this introducing the idea of hybrid designs. And we've come to find out use of the word design really throws people for a loop. These are really an approach to studies, but they're not a research design per se. And so we'll talk about what that means. And I think I've gotten the word design out of my slides everywhere, and we'll probably find at least one that I haven't yet caught. And we'll try to make sure that I don't say design either. So think of them as hybrid studies or approaches. So this initial paper introduced the idea. We have a paper if you really want more concrete examples. I like concrete, practical, what to do. So I wrote the paper I needed. So this is our 2019 paper that gives you another introduction. You'll see it still says designs, but it talks about each type and gives examples of each. And then we have a more recent paper. I guess it's not so recent now. It's 3 years old now. Reflections on 10 years of hybrid studies. So we shifted there and we'll talk about kind of the ideas and thoughts we give in this paper. So those are kind of 3 key papers that would be helpful when you're thinking about hybrids. But first, I'm going to start with this paper. I know that you all are doing implementation work, and so I don't have to teach you what implementation is. And there's some language that makes talking about hybrids a little easier. So we badgered Jeff into writing this paper called Implementation Science Made Too Simple, because he has a way of teaching about implementation that makes talking about hybrids a whole lot easier. So this is linked here. And so this paper talks about the language we use, and we use some very non-scientific language that can be super helpful. If you're also trying to explain to your parents what you do for work, it's also helpful. So when we're thinking about implementation science, the intervention, the practice, the innovation, whatever you want implemented, we just call the thing. We do a lot of work. I have appointments in psychiatry and internal medicine. I'm a psychologist, so I often don't know what my internal medicine colleagues are talking about. So I have to figure out, okay, whatever you're implementing, maybe it's treatment for pulmonary embolism, or that's one of the more recent ones I've done, or treatment for a certain brain disorder. As an implementation researcher, I can just think, okay, that's the thing that we're trying to implement. And so effectiveness looks at whether the thing works. And then implementation research looks at how best to help people or places do the thing. And implementation strategies are the stuff we do to try to help people or places do the thing. And so you can see it's a little silly, and it makes it a lot easier when you're trying to parse out what's the thing we're implementing, what are the strategies we're using, and does the thing work, and do our strategies work? And our main implementation outcomes are how much and how well they do the thing. So you'll notice I talk about use this language quite often because it helps to kind of be really simple and think, do we care more about how the thing works or how we get the thing into practice? So using the language of the thing, hybrid approaches look at both, does the thing work, and how do we get folks to do the thing? And as I think Vanessa mentioned, there are types. So we'll talk about the different types of hybrid approaches, which tend to emphasize either or, if the thing works or how we get folks to do the thing. I probably don't need to sell you on why you should consider hybrid approaches if you are taking an hour and a half out of your day for a webinar. But the idea is we want to kind of speed things up a little bit. If you wait till you have great effectiveness data before you look at implementation, you may have people in the world who really need the thing you want to implement, and they need it sooner. So we don't want to wait for perfect intervention effectiveness data before we go to implementation. And we also know that when we're looking at implementation, we can maybe backfill effectiveness data that we'd like to have. And the other thing I always worry about is it's important to know how well do folks need to do the thing to get the outcomes you want, right? So it could be that maybe you have a treatment that folks can have maybe moderate fidelity too, and still get really good outcomes. But you won't know that unless you look at both implementation and effectiveness outcomes. I mentioned a little bit of differences from the original paper than how we talk about them today. The original paper, and even to be quite honest now, we really talk about things from a clinical orientation. Most of the folks on that paper were clinical psychologists, psychiatrists, or folks working in healthcare settings. But it really works for other types of things. So implementing a policy or implementing interventions that have nothing to do with healthcare. Maybe it's in a school setting, maybe it's in a prison setting. I've tried to shift away from clinical effectiveness to more just effectiveness. And the original paper also focused on trials, which I think is part of why it got called a design instead of an approach. But the hybrid idea is being used in all sorts of research designs. And so really we're thinking about what questions we're combining. So that's why we're calling them hybrid approaches or hybrid studies and not a hybrid design. And one of the things I review grants for folks I see often is they talk about using a hybrid approach as their study design, but then they don't specify their study design, and that will get you dinged by reviewers. So let's talk about the types. So we have really fancy names: hybrid type 1, type 2, and type 3. I will tell you, at one point when we were writing the 2022 paper, we thought we should really specify these in more detail, and we ended up with like a 1A, B, C, a 2A, B, C, and we thought it would be helpful. And we had ourselves so confused that we have ditched that completely. So I just say that to you, that you don't have to worry about us creating more types of types, because it was silly in the end. So we're going to start with a hybrid type 1. So hybrid type 1, your main focus is, does the thing work? And then while you're testing if the thing works, you're going to gather information on doing the thing. So you're going to look at implementation barriers and facilitators, learn about your context. But really the goal is, does the thing work? And so this is, it might be you're doing a clinical trial and you're adding on a process evaluation. And I'll go through each type in more detail in a few slides. But this is really, does the thing work, with some about implementation variables. On the other side, we have a hybrid type 3. And this is more about testing how we get the thing implemented. Maybe you're comparing implementation strategies or strategy bundles. And then you're secondarily looking at, does the thing still work? A lot of times folks still want to collect that data to make sure it's still working, or look at varying levels of implementation and how it impacts effectiveness outcomes. So you kind of have your two extremes there. Hybrid 1 is more, does the thing work? Hybrid 3, the primary focus is, how do we get the thing implemented? And in the middle is the hybrid type 2, which is some combination of those two. We tend to call these co-primary aims, which people struggle with that language. But you kind of have a equal-ish focus on if the thing works and how do you get the thing implemented. And we'll talk more on a few slides about what does that look like. Is it 50-50, 40-60, 80-20? What does the focus look like? But these are our 3 types. I have this is the exact same information, and some folks like it more in text versus a visual. So this is the same information. Again, I'll make sure you have these slides. So let's go through the types in a little more detail. So let's go, our hybrid type 1. So again, we are testing more the effectiveness of the thing and exploring implementation related factors. And as I said, this is a conventional effectiveness trial or study plus something else. I really think when folks are doing effectiveness trials, if they're good at doing effectiveness trials, they're already thinking about this stuff. If you think about an effectiveness trial, you're doing lots to control the environment to make sure the thing gets done as it should be, to see if it works. So you're thinking about, do I need to pay people? Do I need to block time? Do they need training? Do they need fidelity checks? These are all strategies you use to conduct a trial, and they might later be strategies you use for implementation. So they're things I really think, if you're doing a good trial, you're already paying attention to. So you might do a process evaluation where you look at barriers and facilitators, what worked and what didn't work. You might learn what might need to be adapted moving forward. And really what's needed to support people or places to do the thing. So you're really thinking about what can we learn while we're seeing if the thing works. You should do a type 1 if you have limited effectiveness data, which means so if you don't have enough effectiveness data, so just focus on implementation wouldn't be appropriate. At the same time, it gives you a good, ideal conditions for looking at implementation issues and learning information to think about what strategies you might need in the real world. And I think where folks get a little hung up on hybrid type 1s is language. So they might say we are going to implement this and evaluate it, but if you say you're going to implement it, implementation researchers assume you're using implementation strategies and you're doing an implementation trial. So I often encourage folks to say we're going to conduct a trial and learn about implementation as we're doing the trial. So again, you're using what we all think of as implementation strategies to do your trial, but you're not calling them implementation strategies. And then you can see some examples of what I mentioned. These are normally resource intensive, and they might be things you'll use in the future, and they might be things that are too resource intensive to use in the future. Sorry, I have to move around a little bit in my office, turns the lights off. But again, you can learn from all those strategies because maybe you learn we paid people and we probably had to pay them more, or it took weekly fidelity checks to keep people barely doing what they needed to do, or you'll learn a variety of things during a trial. And so these are just some examples. I tried to put for each type some examples that I like. I think all of these, I couldn't figure out how to link the picture to the link, but I believe all of these are open access articles. And I tried to pick a variety, so not just all mental health. I do a lot in mental health space. But you can see there's one here in operating room to ICU handoff. But there's some really great examples out there. I would encourage you, if you're thinking about doing one of these studies, the number of protocol papers out there now is outstanding to me. So I think you have a lot of good examples of what these can look like. And if you need help finding some, feel free to email. So those are hybrid type 1. And Vanessa, since I have mucked up my webinar views, are there any questions in the question about hybrid type 1s before I keep going?
Yeah, not yet. But
Okay.
would you like me to let you know as questions come in, or do you want to wait
Yeah,
until
feel free to
then?
shout
Okay,
out.
perfect.
Yeah, I'm used to people just shouting out, even though now I've made it so I can't see anything. But that's all right. Feel free to shout it out.
Perfect. Thank you.
So that's our hybrid type 1. On the other side is a hybrid type 3. So again, this is if your main goal is to test implementation strategies. So maybe you have 2 different strategies or bundles and you want to see which one works better. And your main goal is to see how do we get this thing implemented? And you'll still gather or observe information on effectiveness. So when would you do this? So sometimes you'll see that I always like this bullet point. It says we proceed with implementation without completing a full portfolio of effectiveness studies. Sometimes the environment or the agency within work has decided this thing is good enough or is better than what we have, and we're rolling it out. I work in a large healthcare system where often something has promising enough or good enough data, and we don't have something better. And so it gets rolled out maybe before the researchers of our group say, yeah, we have enough to say it's ready. So you might do a hybrid type 3 to compare how you might implement this the best and still want to collect effectiveness data. You also would use this, again, if you want to see how does my effectiveness vary by quality or level of implementation. So for example, there was a study on psychotherapy for depression. I can't remember which treatment it was. And they found that for folks with mild to moderate depression, only like mild to moderate fidelity of the treatment got you really good outcomes. So you didn't have to be highly adherent to the treatment to get good outcomes for folks with mild to moderate depression. But for folks with severe depression, high fidelity was needed for the good outcomes. And I think that's really important to know, because if you have a thing that's really resource intensive or takes a lot of training, it'd help to know to what level do you need to get folks to get the outcomes you desire in the setting you're in. So that's when you might use a hybrid type 3. When you think about a type 3, you need to think about, and again, you don't always have to do a type 3, right? If you're only interested in comparing the implementation strategies and you're not so worried about it, the thing outcomes, you could just do an implementation trial. So you could, it's kind of a decision between, do I want to do an implementation trial versus a hybrid type 3? But you want to think about how much power do you have, for how many sites do you need, kind of the typical things you need for any trial. You want to make sure you clearly state the evidence for your implementation strategies. So when we're looking at proposals for hybrid type 2 or type 3, we also want to see how you've chosen your implementation strategies, right? Do they have evidence for them? What's the mechanism of action for the strategy? So if you say this thing is not getting implemented because people don't understand how it works, then you'd likely pick training as one of your implementation strategies. But if you say nobody does this because they can't get paid for it, training would not be, it might be needed. It wouldn't be your critical implementation strategy, right? You would want some sort of strategy that impacted folks' ability to get paid. And you also want to think about how much do these strategies cost? So I work in a system where they want to know what's the cost of providing the thing, but also what's it going to cost to implement the thing? How much resources do we need to devote to implementing the thing, the implementation cost? So that's likely to be part of what you consider or include in your aims for a type 3. Oh, see, there's a clinical. I didn't get all the clinicals. In terms of intervention outcome data collection, you might want to think about, do you really need them? You might not need effectiveness outcome data and might not need to do a hybrid. If you do, what things would be less burdensome, right? Are there measures available in existing data? Can you avoid primary data collection? Right? If you're doing a mental health intervention here at the VA, there's a lot of measures that are collected as part of usual care. Are there things you can use that would reduce the burden on both your participants and your study? And hopefully they've decided to, I think, cut the grass outside my office. So hopefully that's not too noisy. So these are some type 3 examples. A lot of them are from actually folks here in Little Rock. So there's one, my colleague Taryn Swindle does work in obesity prevention and childcare. A colleague of mine, Mike Couture, has done fidelity of cognitive behavioral therapy in rural VA clinics. It looks like almost all of these I did in healthcare systems. But there's lots of, Taryn's done quite a bit of work. Hers actually is in childcare settings. I lied, that's a childcare one. But we have, again, lots of study protocols. So if you need more ideas for what type 3s can look like, feel free to reach out. All right, I'm checking my time. So back to our hybrid type 2. I think of the 3 types, the type 2 is the one that's liked least by most people, and it's my favorite. Type 2, I think, is the most murky. So you're testing both the thing and the implementation strategy. So it's a dual focus. And we kind of think of these as 2 different types of type 2s, which is how at one point we started to try to specify them more specifically. What's most common is that second one, the single arm, quote unquote, pilot study of one implementation strategy or implementation bundle. So you are using one implementation strategy or bundle to implement the thing, learning about it, and gathering effectiveness data. That's what we see most commonly. And one of the examples of one of my papers that I have later in the slides for you is this type of type 2. The more complex and resource intensive type 2 is dual randomized hybrid type 2, where you're implementing implementation study of 2 or more strategies. So you're randomizing places to one or the other strategies or strategy bundles, and you're randomizing folks to get the thing or not get the thing. Our colleague Brian Garner, I think, wrote the most elegant dual randomized hybrid type 2s. So I think I have one of his examples, but his were the most elegant, and you can read them and think, oh my gosh, that was a lot of juggling. So we see less of those because they're a bit more difficult to pull off. Indications, when might you do a type 2? So if you have effectiveness data already, but maybe not for your setting or your population, or maybe you have effectiveness data and you think, I need to adapt this thing enough that I still think I need to get effectiveness data to see if the adapted version still works. You also want to make sure that you have data on barriers and facilitators implementation already available. Maybe you've done a study, maybe you did a pilot, but you want to have some knowledge on what are implementation strategies addressing? What barriers and facilitators are we addressing with these strategies? And you might also be helped by having some implementation momentum. Maybe all of a sudden clinical practice guidelines change, or your healthcare system says, here's a new policy, you have to offer this. That might help push you from a type 1 to a type 2. Some more considerations. You want to have an explicitly described implementation strategy that we think is plausible. So in a hybrid type 1, you're not going to have implementation strategies. You're just learning about implementation variables. In a type 2 and a type 3, you want to have an explicitly described strategy. You also want to have an explicit measure of an implementation outcome, so adoption or fidelity, of any of those types of implementation outcomes. And the thing that I think is the hardest, and Jeff and I in our group have maybe the most conversations about, it's important to be clear about what's the thing versus what's the implementation strategy. So for example, if you're delivering the thing and it's an evidence-based thing, and now you're delivering it over the phone or via telehealth, is delivering it over the telephone an implementation strategy? Or do you think it fundamentally changes the thing so much that now your intervention is adapted and it's part of the thing? I don't have an answer for you, unfortunately. I can actually argue both sides, it seems. What's most important is that you decide for your thing and your setting and your implementation what you've decided it is. So is the delivery format a strategy, or is it part of the thing? And you want to specify that. But I feel like this is one of the things we go round and round about a lot of trials we get feedback on. You also need to think about, what if your strategy doesn't work so well and it compromises your effectiveness trial, right? So what if you have picked poorly and it's not the strategy, or you needed other things? So what to do about this? You want to make sure you're using implementation strategies that have an evidence base. You want to build in adoption or fidelity benchmarks. You want to be checking at certain timeframes about, is this working and do we need to switch gears, and what's our plan to switch gears if there's poor adoption or fidelity. And I always leave Jeff's final bullet in there. That's a Jeff statement about anybody getting queasy over this. I feel like hybrids and maybe research aren't for the faint of heart. I think these things are difficult, and we need to think about them and have a plan for them, and knowing that things might need to change rather than hoping they don't happen. So here are some examples of some type 2 protocol papers. I did include one of Brian's papers. So that top left one is a dual randomized type 2. All right, so I have a couple minutes left. So I want to make sure we hit a few things before I hand off to our next presenter. This is again, our most recent paper. We tried to specify things we've thought about or changed our minds about, or things we saw that we didn't like, and things we saw with hybrids. It also has a tool for choosing which hybrid type you are. So the paper talks in general about 5 things. Replacing the term design in favor of study or approach, which will help you when you're writing a grant, because then you can say we're using a hybrid approach and here's our study design. Maybe it's a randomized controlled trial. Maybe it's a single arm trial, observational study. It gives you some guidance on how to select a hybrid type based on the evidence in your context. And it gives you a series of questions, which I believe are on the next slide. And then it talks about, problems we see with the hybrid typology. One of the things we tell people to do, it's really tough when you're reviewing a grant, if you say it's a hybrid and you don't say which type it is. Because then it's hard to say, well, maybe it's a 1 and maybe it's a 2, and you want to say hybrid type 1, hybrid type 2, hybrid type 3, and then specify why. And we also give some recommendations on research designs that work well with each hybrid study type, and then some thoughts on how to integrate cost into hybrid studies. So this is just the 4 questions to consider. It has you think about the nature of your effectiveness data, how much you think the intervention will need to be adapted for where you want to use it, how much you already know about implementation determinants in your context, and how ready are you to evaluate a real-world implementation strategy or package of strategies. There's a secret 5th question that used to be in when we used to give these talks and workshops. That was number 5 was like, do you still want to do this? After thinking about all these things, do you still want to do this study? But so those questions can help walk you through what type you might use. I'm going to stop sharing for a moment so I can find you all again. I want to show you some resources before I hand off, but I can't figure out how to do that without stopping sharing. Okay, so I'm going to scroll to some resources. In the slides that I'm going to send to Vanessa to share, there's an example of a hybrid type 2 that I left in there, just so folks could have some more detail. It's a published type 2, but that way you all have it if you want more detail. And I'm gonna be successful. I'm gonna share these again. I know I can do this. Allegedly. Okay, there we go. And I want to have you back now. That's lovely. So just some resources, because this work, I think implementation work is hard. So not just hybrids, but this work is hard. So I'm part of Query. We're one of a Query centers within the VA. We do lots of workshops and trainings. There's different cyber seminars. At one point, these were taken down, and I think they're in the process of putting them back up. So some of the links may be a little wonky for the moment. We have a special issue in psychiatry research about introduction to implementation science. The VA paid for open access fees, so the whole issue of that journal is open access, and it's a nice intro for implementation research if you don't want to read a whole textbook. As someone who doesn't like to read whole textbooks. There's also the Society for Implementation Research Collaboration, or SIRC. So I'm a past president of SIRC, so I'm a little biased. It's a great organization. We have an every other year conference. It's a lot focused on biopsychosocial interventions, but it doesn't have to be those things. And at one point we had members from over like 25 countries. So we have some good representation of international folks. And it's fun. We have a fun time. I think our next conference is in September of 2026. These are some resource lists, some videos, and then shameless plug. If you know folks who live in the US or want to live in the US, we have a postdoctoral research fellowship here in our South Central MyRec, and it's open to psychologists, psychiatrists, pharmacists, nurses, and social workers. So anyone who's a licensed independent professional. I mentor people through that. So I like to find folks who are interested in this. And I always share a picture to show you that we look nice. We're a nice group. And I'll put this again, but I'll stop sharing. I want to make sure we have time for our other presenters. But I'm happy to answer more questions as we keep going. And again, I will tell you again, I need to add this as a slide. We do free consultation. It's usually like a 40-minute consultation on anything implementation science, actually, but we like hybrids better because we like to argue about them. So feel free to email me And I will tell you again, it's an enthusiastic group that gives feedback. And so I like to tell people that before they come so they don't feel like I don't think we're aggressive. We are enthusiastic. So I think you deserve a warning about that. So feel free to email me if you're interested in something like that. So Vanessa, I'm going to stop talking so I can hand off to the next presenter.
Awesome. Thank you so much, Sarah. That was amazing. So informative. And you did such a great job at breaking down, I think, such complex approaches to research and study design that I think I have a lot of questions, but I think you did such a great job of breaking that down and really providing the rationale and helping with that decision making in terms of which approach you might be taking. And I'm even reflecting on some of the studies that we've done in the past and thinking about that. So definitely have some questions for you, but we have a question in the Q&A as well, but maybe we'll wait till the end and pass it over to Ebrahim and Gabriela for their example from Childbright.
Sure. So I'm going to share my screen and let me know if you can see it. Can you see the screen?
Yes.
Perfect. So thank you so much, Sarah, for the presentation. It was really informative, and it was really great that for us also to reflect on our study design for this example that we are going to present. Thanks to Vanessa and Corey for having us, and Gabriela and I were so excited and happy to present the Jouer app project, where we use the hybrid implementation effectiveness approach in our study. So I wanted to start with a quick like a background, an introduction, like how the Jouer app was born. We all know that the participation is a human right and is essential for childhood development, for improving their physical and mental health. But children and young persons with disabilities face numerous barriers to participate in leisure activities. And one of the significant barriers is the lack of access to information about adaptive and inclusive leisure activity. For example, their parents don't know how to find the right information about leisure opportunities in their community. So that's how the Jouer app was born by Dr. Kiyoko Chicago in 2015, and it was a response to the lack of access to information about adaptive and inclusive leisure activity. And it was developed through an integrated KT project and participatory approach. And as you can see on the screenshot, on the image on the slide, it connects children and young persons with disabilities, parents, clinicians, and educators to different leisure opportunities such as arts, camps, sports in their communities all across Canada.
Yeah, so although the app has been existing for 10 years, there's kind of two challenges that we're encountering in kind of the implementation side and the take-up of the app. So the first challenge is more on an individual level and an effectiveness question. So there's a need for more engaging and user-friendly experiences with the app. And that requires also, in one angle, behavior change strategies. So to increase engagement with the app and to support actual participation outcomes. And then there is a second challenge that comes with it, which is more of a collective systems level question. So it's more the implementation question. So it is recognized, there is a recognized value for the app, and there's about 5,000 users across Canada, but it's still a limited uptake, thinking that it could serve up to 800,000 families. Um, so the question also kind of comes from the utility and the feasibility of implementing the app for clinicians, for educators across communities, for parents and youth to be using. So the objectives of this current hybrid effectiveness implementation study is to, first of all, test the effectiveness of the new version of the app. So Ebrahim has been working on it, and he co-designed a version, a new gamified version, and a test a new version of the Jouer app with end users, so with youth, with parents, with clinicians, with educators, embedding gamification elements in there. So kind of this aspect of behavior change techniques. And in the implementation side, so we are testing out the one strategy alongside. So we're trying to expand the pan-Canadian knowledge brokers network to help us scale up the app use and to integrate it into everyday use and routine practice.
Also, a little bit about how we co-designed the new gamified version of the app. We use human-centered co-design approach within our patient-oriented child bright network, and we took a lot of steps. We closely collaborated with young persons with disabilities, parents, clinicians, and even community organizations. And we have done a lot of steps, like we started with a scoping review to identify the gamification strategies that have been commonly used in mobile apps for children with disabilities. And we use those results to inform individual interviews, brainstorming workshops, co-design sessions with the end users. And the prototypes went through usability evaluations. So you can see the citations on this slide. And here are some examples how we co-designed the new gamified version of the app. And here's like a sample of the new version of the app with the new gamification features, where now children and young persons with disabilities can create personalized leisure plans, can track their progress over time. One important feature in the app is that they can reflect on their participation experiences, linking to the efforts framework for childhood development. So it was one of the feedback from the parents that they want to have this opportunity to reflect on their participation experience. So it means once they participate in activity, they can, the app asks the users, how did they feel participating in activity and what did they get from this activity. There is a reward system to increase their motivation. There's a lot of fun visual features to celebrate the small wins, and there was a huge emphasis on personalization. So one example is that the app suggests activities based on the preference and locations of the users. And specifically for our healthcare professionals, they can connect with their clients through a QR code or email. They can track their clients' progress and also endorse trusted leisure activities in the app.
So kind of an overview, the kind of overarching study design, what we've learned now that study, not design. So it's a hybrid type 2 design that we kind of decided to go with. So we're testing the implementation strategy of creating and using this knowledge brokers network across Canada, while also testing and observing and gathering information on the intervention's impact on relevant outcomes. So when it comes to the effectiveness part, we're doing the first part. It's a mixed method study. It's a feasibility pilot, not randomized study, which is ongoing right now. And then the second part will be an interrupted time series at the population level, which will be upcoming.
As Gabriela
Yeah.
mentioned, we have two components exactly for effectiveness. And the first part is the mixed method pilot feasibility study. And we are going to evaluate the feasibility, acceptability, and user experience in a sample of 15 participants. That it can be a young person with disability, parents, and clinicians, or Canada-based, have access to iPhone and internet, and they can speak English or French. Here is the study procedure of this pilot study. We had one-on-one onboarding meeting with each participant, and we showed them how to get the new version of the app, and I demonstrated key app features and how they can navigate the new version of the app. They were invited to use the app over 2 months, and they received weekly reminders. And at the end of the study, we have surveys and semi-structured interviews. And what we have seen so far was really promising, because it's my doctoral work, and it was really exciting to see the results of all of those co-design process. So in terms of user satisfaction, we received a good response from users, 4.2 out of 5 stars. The system usability scale showed acceptable usability with definitely room for improvements. In terms of the potential benefits, participants could create personalized leisure plans in the app. And it was really exciting to see that they could participate in different leisure activities, from attending swimming or visiting a botanical garden. We are collecting data in terms of the different metrics like recruitment, retention, and engagement. We also look at the barriers and facilitators to see what factors hinder or support app use to guide next step improvements. And I also want to highlight the contextual factor, the importance of the contextual factor. We have seen in this pilot study that contextual factor importance, such as availability of leisure activities appropriate to each child's disability. As an example, one parent in PEI really loved the app and she loved using the app, but because she couldn't find a leisure activity appropriate to her child's abilities, she couldn't use the app further. So this shows the importance of the contextual factor, like availability of leisure activities, and also us to advocate for building more inclusive community for all children so they can play. And after this pilot study, we are going to move to the second part of the implementation, which is assessing impact of gamification at the population level in the current app users in two groups, the intervention and control group. And we're going to look at different outcomes. In terms of primary outcomes, we're going to look at the engagement. And in terms of the secondary outcome, we are going to look at retention and activity attendance. And we are going to use segmented regression for the analysis of these data.
So now moving to the implementation side of the study. So while we're testing this new version of the app, we're simultaneously trying to scale its use across Canada and kind of also prepare the terrain. So for when the new version is out, we already started the implementation efforts. So our implementation goal is also quite ambitious. So it's across populations and sectors. So we want parents to be using it more and youths to be using it more, and to also have community organizations use the app, and healthcare professionals and municipality workers. So we're already going on a large scope across the country. And as we've been starting kind of understanding uh how why has it been implemented well so far, and some barriers that we faced. So while we're trying to create this pan-Canadian network of knowledge brokers, I kind of realized that there's quite of a low awareness about the app. So many organizations that we list in the app as offering activities that I've contacted don't know that we exist and don't know that we're in the app. So already there, it's hard to implement something that people don't know exists. Then there's also a question of capacity. Very often when I would contact people to kind of try to build a connection with them, to try to start to build the work of implementing the app in daily life, routine practice, there's a question of capacity. People are busy. Now you come to them with a new tool, with something new to implement. So that's also one of the barriers that we face. And then also finally, kind of the sustainability of the current approach. So as great as the idea of the app is, and how it really was created to address a barrier of access to information, we are a small team and we update the activities manually. So having all the activities of all the organizations up to date all the time across the country is a bit difficult. But that problem would kind of be solved through proper implementation, because it can also be crowdsourced and people can also put in the activities themselves. So if community organizations are aware about the app and understand the utility of the app, whenever they have a new programming come out, they can just take the time to input that information in the app as well. So it's more accessible. If we have good relationships with community organizations, when the programming is not available anymore, they can always message us then, and we can just disable the activity on the go in the app. So kind of going with this, we're asking ourselves, how do we scale up? How do we keep that information updated? And how do we embed the app in existing systems? So our implementation strategy, we did a sort of a rapid realist review, not to be published, but within our team. And one of the most common and most effective strategies that we encountered was the use of champions to kind of spread awareness and help implement it. So we built a kind of a similar strategy. We're wanting to expand a pan-Canadian network of what we call knowledge brokers, which is pretty much a synonym to champions. We are trying to build on kind of naturally existing knowledge brokers network. So finding people who are current champions in the communities, for example, already people who are part or executive directors or part of programming of community organizations, people who work in programming for leisure activities for municipalities, and parent partners, and Their role would be to spread awareness across the communities that they have access to that we don't about the app, and support uptake so that we can also adapt it to their existing needs. And the champions, the knowledge brokers that we have that are involved in programming, that are involved in community organizations to help us keep up with available activities. We also are aiming to have a kind of a diverse network across sectors, like I mentioned earlier, to really maximize reach and help the integration of the app across daily life, routine practice across sectors. So what does being a knowledge broker entail in this case? So we have the program, we're testing it for 6 months. We'll have we started, so we have monthly meetings to check in on dissemination efforts and kind of reflect on the strategies and the audiences you have access to. And there we'll also have a few questionnaires that we administer. And ultimately, we're aiming to do a social network analysis. Where we're at now in the project, so at least we have right now we have almost at least one knowledge broker per province and territory. We have 2 territories when we have no one, but it's a bit more difficult to reach there. We have collaborations with other networks like the CDPP, working on municipal guidelines with municipalities to increase their visibility. We've had so far 2 meet and greet meetings together with our knowledge brokers. We co-design with them the terms of reference of what their role would entail. Overall recruitment was not easy. People are busy, so that took us a bit longer than we anticipated. And we recruited by means of emailing community organizations, listed in the app, as I mentioned, utilizing existing contacts and network that we have to identify potential KBs. Ultimately, although we wanted to branch out and include people in the network that we didn't already have strong relationships with, being introduced to someone by someone helps more than just cold emailing. And also some of the knowledge brokers that we recruited are also partners from the effectiveness study that Ebrahim's working on and long-term partners of the Jouet research group. And so finally, kind of an overview of our expected results. So from the knowledge brokers part, the readiness to kind of champion Jouet even beyond this implementation study, and through this, expanding the understanding of the value of Jouet, and also expand naturally our networks and our current networks and intention to continue to disseminate the app. When it comes to system implementation outcomes, so a higher engagement with the app, also higher, because it's an app, but there's also a website, so also maybe more visits on the website, increased number of active users across provinces and sectors, and also ultimately an increased awareness about gaps and opportunities in leisure across actors and sectors. And finally, we want to acknowledge and thank all our partners. So here we have, as you see, it's Ebrahim and me presenting the study today, but our team is much larger than that. And we also collaborate. So we're a Child Right Project with the SPOR, with Fonds de Recherche Santé Québec, TELUS, Kids Brain Health Network, CIHR, McGill, CRIR. So we have a lot of collaborators and partners in this to make this possible. Yeah, that's it. Thank you for listening and taking the time to learn about our project and us.
Amazing. Thank you. Thank you, Gabriela, Ebrahim, Sarah. That was fantastic to have that introduction, some of that foundational core content, and then bringing that example to life. And I love how even as you were presenting, you were incorporating some of the learnings from Sarah's talk into how you were sharing that. So that's fantastic. So another friendly reminder for people just to put any questions you have in the Q&A. Unfortunately, you can't unmute yourself. So just putting them in the Q&A and then we'll share that with our presenters. So we do have one question. I don't know if everyone can see it, but I can read it out loud or more of a comment, but perhaps we can frame this into a question. So thank you for the details and simplicity and complex methodological rigor. Looking forward to such studies in rural and remote Indigenous communities for musculoskeletal, I'm assuming MSK, healthcare services, equity in Canada and Australia. And then there's an example PACE, rural, etc. So maybe we can turn that into a question. Sara, Gabriela, Ebrahim, do you have any particular examples of hybrid approaches being led by Indigenous communities, incorporating Indigenous methodology into maybe that's the more formal study design? Have you seen any examples or different ways in which these types of approaches have been used?
Sure, I have a couple of thoughts. I do think just in terms of equity, there's a lot of focus on equity now in terms of just implementation science in general, right? So making sure we implement things equitably. I can't say that word apparently, right? So that we don't have settings that are under-resourced who aren't getting things implemented, and then the higher resource settings that are, so we can look at equity of implementation. So our behavioral health query renewal funding starts a week from yesterday. And our new 5-year goal was to focus on equitable implementation. So not just can we get it implemented, can we get it equitably implemented and make sure all sorts of folks have access to whatever it is we're implementing. So I think that's recent, I think maybe last few years, increased focus. There's one of my colleagues, Eva Woodward, developed the health equity implementation framework. She has 2 papers, one that describes that she combined health equity variables with IPARIS, and then she had a more practical guide. So there's 2 separate papers, and I believe both are open access. So that's helpful to consider. And you also asked about in terms of where I've seen this. So I'm actually part of a hybrid type 1 clinical trial in Alaska. And we are looking at does an adapted advanced care planning intervention, so helping folks do advanced care planning and thinking about what kind of care they would like towards end of life. So it's been adapted for Alaska Native American Indian populations. And then we are looking now at implementation. How do we implement the adapted thing? So they worked, and we're implementing in a tribally owned healthcare system. And we used to get, so within that, since it's tribally owned, they call the patients customer owners because they're both a customer and an owner as part of the tribe. So they used customer owner feedback, and they did talking circles when they did their qualitative work. So they use those methods, and it's pretty neat. So I am not Alaska Native or American Indian, and I'm in Little Rock, Arkansas, not Alaska. So the team brings our team to Alaska every year, and we've been at different seasons for different events. We've gotten to go visit the clinics. We've gotten to participate in cultural events. So it's been pretty, like, it's a pretty lovely thing to actually have a better sense of the community and the place and the people that we get to implement with. So it's been I also apparently really love Alaska, but it's been really fabulous to kind of, as a research team member, get to actually have a better sense of the community that I'm not part of. So they've done a really fabulous job. The PI is Jen Shaw. She's at University of Alaska Fairbanks. And so it's funded by National Institute of Nursing Research, funded it. So it's looking at that, but it's just one example in terms of same overall kind of approach, and they've kind of customized it to fit the culture of the people they're working with. So it's really been fun.
That sounds incredible. And lots of rich learnings and experiences embedded in that. And I'm assuming it's still underway. It's not published or any.
Right. We are in the clinical trial has started.
Okay.
We have a protocol paper. I think that's a revise and resubmit. And then we have a paper that's maybe a revise and resubmit for our AIM-1 qual work, I think.
Cool.
Awesome.
Awesome.
And it's interesting. So since it's a tribally owned healthcare system, we also all of our papers go through tribal review. So they help. I've also learned a lot about just language. So they've helped us think about our scientific papers and the language we're using. And it's fun.
Amazing.
You get to learn stuff, so I like it.
I love that. Okay, fantastic. So there's another question in the chat. So we'll focus on the Q&A, and then if we can have a little discussion if there's any additional questions. So here's another question. So I feel hybrid studies can become quite complex and ambitious. In parentheses, I may be wrong. I wonder what could be your suggestions so that the research can remain still feasible and focused.
I think I get overexcited, so I tend to just add stuff to studies, which is just a different problem. Maybe it's not because they're hybrid. I think that's dispositional. I do think, though, it can get complex, and we really use that language of like, okay, we're implementing this thing. Does the thing work? What are our key things we care about? Can we get the thing implemented? What are the key pieces we care about? And what can we maybe let go of? We also do mostly community engaged work with whatever that community is. So for me, it's mostly the healthcare system at VA. And so it's a lot of talking with our leadership to see what they care about. Because sometimes they're like, oh, that part, that's cute. Like, if you want to do that, that's cute, but we don't need to know that. So I think making sure all the folks impacted by your work care, like keep the things they all care the most about, and then think about what you can let go of is what I try to do. And I'm not very good at not making it complex. So I'll just say that also. My light's back on. There we go. Sorry. It's my physical exercise intervention.
Maybe I can ask to tease out a little bit more from that, Sarah, because I think that's fantastic and a really great response. Recognizing in one of your slides, you talked a little bit about cost analysis. As KBHN, we, as along with ChildRight, are funders of implementation for neurodevelopmental disabilities research, and we don't have as much money as I wish we did. I wish we could fund a lot more, and I think that's true across all of the folks on the call who may be applying for some of these funding buckets as well. So maybe I can ask kind of further, what are areas that you've identified as kind of high return or areas of cost kind of savings or cost, or judicious cost analysis? What might that look like? And feel totally free to say, you should check out the paper that I recommended, but just wanted to throw
Well,
that out there.
So I think, I don't know if I have a clear answer. I keep wanting to say just it depends. There's a lot of my work, especially in the VA, is more quality improvement and program evaluation. I work directly with operations folks where they're like, we want this thing implemented, like help us get it in there. And then I'm like, yeah, and I want to learn about it. And so we have funding that helps me learn about it while they're implementing it. And so it's helpful for me, right? Because I know what our main goal is to get the thing implemented and what my operations partners need to know. And they usually need to know what's it going to cost to get it going? What's it going to cost to keep it going? Like, can we use in-house stuff and pay less? What kind of benefit are we getting for this amount of money? Like, how many people does it? Like, so I think there's some benefit in that I have pretty clear requests or demands feels a little dramatic, but there's things they need to know to be able to do their jobs. And we try to make the best use of what exists within our healthcare system. So for example, if I'm doing something with depression care, I'm going to use all of the depression measures that VA already uses. So the PHQ-9 or service utilization, or we have a fabulous health economist who's like, here's the data you have available already as part of usual practice. And we think about what we can use with that. And then if we want to look at other things, what data is needed, and really what's the cost of getting the cost data, right? How much effort does that take, and do you need it? So for example, we have a implementation facilitation learning hub here at Behavioral Health Query. We train people to be facilitators as a strategy. We have all sorts of tools to track facilitation as a strategy. We have one tool that tracks facilitator time and effort, and we ask them to track a bonkers number of things for each thing that they do as a facilitator. As like a nerdy researcher, it's fabulous. And my facilitators are like, could you go away? Could you leave me alone? We have one of our most expert facilitators would like run from us because she was like, I'm not doing that. That's silly. There's a big cost to getting like, okay, Corey, you're our facilitator. And on September 25th, you met with 10 people. What were each of their roles and their titles and their names so I can see how much money it costs to have them in that meeting? What kind of activities did you do? And you're gonna be like, no, I had a meeting. Go away. Right. And so we have that data is needed if my study is about what facilitator activities and people need to be there. If my study is simply, does facilitation better than technical assistance to get my thing implemented, I may just need to know I paid Corey half time, and that's what it costs for facilitation. Right. So I think thinking through what would be cool data and fun to have versus what's my main question that I'm trying to answer. And I do better at that telling somebody who's not part of my project what my project is. Because I want all of the data. And my data analyst down the hall will be like, girl, no, you don't. Stop it. Right. So I've now like lost track of the full question you asked me. I do think though, figuring out what's needed for the question you have, what data is already available, what could we make use of, and making friends with a really good like health economist. We have a fabulous one here. I'm not telling you her name. Don't steal her. I see another question, and I need new glasses. I'm trying to like.
Yeah, that's me. I have a lot of questions on lots of things, but my question's actually for Gabriela and Ebrahim, and it's always nice to see the work of the Due app. And where I'm particularly interested in is that sustainability piece, particularly for keeping the app up to date with those different components. And just curious how it's gone with relying on communities and different routes to be able to keep that updated, and how you're thinking about for the longer term in the future when everybody's always so busy and it's another thing to think about.
Can I quickly add on that, Celia? Because I had a similar question. And so thinking about sustainability of the app, and I was also wondering about sustainability of the knowledge brokers and the champions that you identified as the strategy. And have you thought about that, like their funding or how just kind of building upon that?
Yeah. I mean, I can start talk about sustainability of the app, and then I pass it to Gabby to talk about sustainability of the KB network. Obviously, in terms of that's a great question. We all rely on the community, like as the whole Jouer research team is a community engaged research. So, and in terms of how we sustain the activities, one of our main strategies is to rely on community to let us know what is wrong and what is correct, like in the app. So there is a lot of features in the apps people can use. For example, if they see any information is not correct, for example, if a parent checks an activity and goes to the website is not working, or the activity is not running anymore, or some specific information is wrong. For example, we said the activity is adaptive to a child with physical, but it's not. So they can let us know by suggesting changes to us, so they can email us within the app. There is another strategy that as a small group, we know that we haven't listed all the activities available in Canada. So there is another feature in the app that they can suggest a new activity. But we would verify the information before releasing to the public. So there is, I guess, here are two main strategies that we are currently using the app. And Also, we mentioned about the gamification. We co-designed the gamified version of the app, and one of the like a purpose of gamification to increase motivation and engagement with the app. So we hope that by embedding gamification in the app, people would be engaged more with the app. So these features would be more visible to them. So somehow we can sustain the activity listening. I guess, and now I pass it to Gabriela to talk about the sustainability of KB networks.
Yeah, thanks. Yeah, so that's a great question. I don't have an exact concrete answer to it. So that's why we're actually testing out the study. So I've been on the project for a year. From what I know from before, they have been kind of like champions, ambassadors of the app. But now it's really about trying to build this network across Canada and studying the effectiveness of this method to implement. I think what is great with what we're doing now is that we have managed to bring in people on board that had never heard of us. Actually, most of the network that we're building right now are outside of the connections that we had before. So now hopefully the more connections we build that can bring even more connections, after and kind of have that trickle down effect. And then since we're testing out this strategy at kind of this scale right now, if it works well, if we see there's benefit, then hopefully, we can have the opportunity to try it at a bigger scale later on and kind of just build on it. Hopefully also, I still think that, there's the from a lot of people that I approach to be part of the network, not everybody says yes. So then the person who says yes is a person who already there maybe has that, a bit of extra motivation or a bit of extra understanding of the importance of the app and the lack and the barriers that children and youth may face in and participating and finding information about leisure activities. So hopefully, the people who really get involved do understand the purpose of the app and the need for it, and it kind of maybe creates a natural network and a desire to keep on, spreading the word outside of the study and afterwards. But how to really, really sustain it long term, it's something I don't know exactly. I think it's very important to keep on fostering these connections, though, also outside of the study and trying to support them into supporting us as well. So, for example, a lot of people ask me, to provide the materials, to write the blurbs, to they bring some ideas to make sure that they're heard. I manage also to create connections between people. So through talking to people I was recruiting to help tell me on different needs, this reminds me of somebody else who's working at something else that I met. So, really trying to work on building that network and hopefully these good relations help it sustain. Hopefully that
That's
answers a bit.
yeah, no, that's really interesting in the reliance on the individuals. I'd also recommend, I think there's some work in Australia that's doing something kind of similar, but they have a more automated process for actually identifying many of the resources. So I think it's more of a local community and they add them in, but that might be some of the strategies to think about for sustainability that doesn't rely quite as much on some individuals.
Yeah, that is in the plan, in the works, and going
Yeah,
in
I
the
figured.
grant applications.
Yeah.
But as it all develops, it gets easier. Right now, it wasn't so easy to embed it necessarily in the app, and already just sustaining an app is more difficult than I think we may assume or realize. I'm learning that throughout the project. But I'll just also kind of shamelessly plug in there. If anybody knows anybody who would be interested in joining our Knowledge Brokers Network, please drop me a message.
So I did have another question, unless there was one in the chat. Um, if we have time, are we good? Okay. Was curious because I've with the increase on implementation focus, and everybody seems to be talking about it right now. I've been seeing more cases where people are doing more either hybrid trials or implementation trials before they know about effectiveness. So just curious how you think about some of that, whether it's recommending type one or whether it's really going back to like prove this works before we talk implementation, but still wanting to acknowledge and recognize that implementation is such a big part of anything that we do.
Yeah. I had a rather enthusiastic conversation about that at the last dissemination implementation conference at Academy Health, that in the bar, the conference bar, everybody was like, there's a group of us arguing about that, or maybe not arguing, maybe a little arguing.
I've been in some of those too. They get intense.
Right, like fun arguing, playful arguing. There's been a couple papers that talk about hybrid efficacy implementation approaches. I think it would be silly to do a trial and not learn about implementation. I say that as an implementation researcher and not a clinical trialist. However, every person I know who's an intervention researcher who does them well learns something about it formally or informally anyway. I think it probably also depends on the thing, right? If you are doing a trial of pill A versus pill B, and you think the implementation of the pills wouldn't actually be that different, I guess that would be a little silly, right? You wouldn't expect to have something different or learn a whole lot. But I do think I can envision a hybrid efficacy of implementation study, like, right, because you do your efficacy trial and maybe you do a process eval at the end, or you interview your interventionists, and you interview some, we've been calling them naive sites, right? So I'm on another type 1 trial where we interviewed the interventionists who were in the clinical trial, but then we also interviewed folks who would provide the intervention if it were implemented in different clinics who hadn't done it, to see what they also thought. If like they said, well, gosh, I think that's bananas, I would never do that. Or, oh, if I were to do that, I would need X, Y, and Z. So I think there's ways to do it. And I think it's okay. I have a couple of colleagues who are like, that's silly, don't do that. And I'm not sure they're correct. I could be wrong too.
Oh, that's amazing. I really appreciate your honesty. All right. Well, this was amazing. Thank you so much again, Sarah, Gabriela, Ebrahim, Corey, Celia, Gail, for helping bring this session together. And I saw, Sarah, you answered the question in the chat, so that's perfect. And I know I have a million questions still, so I probably will take you up on that consultation offer. And Gabriella and Ebrahim, I'll probably email you some additional questions that I had about your project, because it's very interesting and exciting. So thank you so much, everyone, for taking the time to be here today, trying out this new webinar style, and just being such a fantastic community. So until next time, our next webinar is scheduled for November 20th, with more details to come soon. So thank you so much, everyone.